Now I am going to discuss regarding the issues of diabetes or diabetes which create problems in the nose. What are the problems which happen in diabetic patients in the nose? Usually diabetes by itself cause problems by increased blood sugar in tissue level. Second one is blood vessel changes like thickening of the mucosal vessels. Third one is degeneration of the epithelial cells and that may be mucosal epithelial cells or olfactory epithelial cells. First we will discuss regarding what are the infections. Commonly either bacterial infections or fungal infections will happen in diabetic patients. If any diabetic patient who has high blood sugar, automatically have the blood sugar level ketoacidosis in the tissues. Any unhealthy tissue there, it will prone to the bacterial and fungal infections. Mainly in diabetic patients, fungal infections are very important because nowadays, if you see going back to the COVID era, when the COVID was pandemic, this mucormycosis has grown like anything and the mucormycosis patient suddenly increased. So this is very important. Local glucose levels will allow the infections to come and invade and become more pathogenic and more tissue invaders, more spreading. It is easily go to the orbit, eyeballs and brain tissue also. This is the very important dangerous infections in uncontrolled diabetic patients. If any patient with diabetes has facial pain or any black crust in the nasal cavity, we have to immediately do the endoscopic evaluation, CT scan examination. If need, we have to do the biopsy to rule out a fungal infection. Second more one is in diabetic patients that blood vessels will thicken because of erythrometer changes or thromboembolic phenomena. These thrombosed vessels will lead the degeneration of the cells. Then it creates a lot of crusting in the nasal cavity, dryness, itching. All this happens. Whenever if you do pricking of the nose in itching, that blood vessels will not coagulate and it will continuously bleed because of the thrombotic or thrombosis or fibrosis of the blood vessels. Third one is in diabetic patients will have the loss of sense of smell because of the degeneration of the olfactory epithelial cells, supporting cells. All this will lead to the anosmia, hyposmia. This is the degenerative process because of this diabetes. So smell sensation will come down, automatically taste will come down. This is also very important fact. Patient will not feel pleasant life because of loss of sense of smell. So control of the diabetes is very important. If you control the diabetes, your nasal problems automatically will become less, especially infectious problems and smell loss problem.